We're seeing that the number of cases has stabilised somewhat in recent weeks, but one of the important and encouraging indicators we've seen is that the incidence in children largely of primary school age, between 5 and 12, which did increase as a result of a significant increase in testing after children in the first week or two returned to primary school, that's fallen right back down as we predicted and expected that it might. That's exactly what we saw in earlier stages of the pandemic. It continues to show that the school environment, and particularly the classroom environment, is a safe and appropriate environment, that the measures that have been taken in that environment is helping to keep children safe and is helping to preserve and protect the ongoing provision of education, which is really encouraging. Unfortunately, we're heading into that time of the year where being out and about all of the time is a bit more difficult. The weather isn't going to be as good, and it's important that we're really mindful of the kinds of risks that are important for us to try to avoid. So as we meet up indoors, we need to try and to be conscious of the extra measures we can take to protect ourselves. First and foremost, we keep emphasising vaccination. Even though over 90% of people over the age of 60 have been fully vaccinated, there's still some people out there who are not vaccinated. So if you're one of those people, or if you have influence over people who have yet to be fully vaccinated or have their second dose, now is the right time to come forward for that vaccination. The other measures are still going to be important. So the wearing of a mask, particularly if you're in indoor places where you're meeting up with other people that you don't know and that you don't live with. So in retail environments, on public transport, if you're visiting hospitality or any of these kinds of places where masks are recommended, you obviously have to wear those masks. You should also know and understand the kinds of circumstances that can lead to transmission and where you should seek to, as it were, to stay away. And the really important message that we want everybody to hear is that if you have symptoms of cold-like symptoms, runny nose, sore throat, headache, temperatures, any of these basic symptoms that we're all familiar with, you should really stay away from meeting with other people, stay home, contact your GP if you're concerned, and be guided by your GP as to what you should do in terms of whether you need a test or whatever. Really important though that you don't go to work, that you don't go to school, you don't go out socialising or invite other people into your home if you have symptoms.